From 12 News, this is Newsmakers.
It's spring, and that usually means the biggest time of year for home sales. But for many in Rhode Island, an affordable place to live may feel out of reach whether you're buying or renting. How long can prices stay this high, and how is it affecting the most vulnerable Rhode Islanders? Welcome to Newsmakers. I'm Tim White, alongside 12 News politics editor Ted Nesi. Here to talk about housing is Michelle Wilcox. She is president of Crossroads, Rhode Island, and David Salvatore of the Rhode Island Association of Realtors. And David, want to acknowledge people at home know you as a city councilman, but because you're here as part of your day job, we're going to refer to you as David and not councilman.
Thank you for that.
Okay, great. But Michelle, we're going to start with you. Our colleague Tolly Taylor was in Newport all this week as roughly 80 people experiencing homelessness were being told to leave a Motel 6 there, which had a contract for 4 months to house people. The head of Newport Mental Health, that's a nonprofit that was handling all that, said this was actually not a matter of money. In fact, they have money left on their grant that they were using for all this. They just don't have a place to put all of them. Is that what you're seeing? Is there enough money relative, I guess, to previous years, but not enough places to put people?
Absolutely. Thank you, Tim. The problem that the folks in Newport are experiencing is happening across the state, and that is, the solution to homelessness is housing, and there is just not sufficient housing. So the hotel programs that opened up last fall for the winter, there are fortunately resources, many of them through the federal government, FEMA and so forth, but it's finding locations, and it's exactly why Crossroads, we're in the process right now of transitioning out of the Nilo Hotel in Warwick, and fortunately we have the ability to transition the folks that were there into other shelters, but most importantly housing, because that's really where we need to go, but there just isn't enough.
So, master of the obvious question here, I assume this is an annual problem as hotels want to free up their stock going into tourism season, right?
Well, so prior to the pandemic, hotels were very infrequently used for shelter. That wasn't something that we typically did as a state. We've always had a winter shelter program where various homeless providers would open up temporary facilities, but using the hotels as shelter is really something that came out of the pandemic.
Do you think it's going to stick around then, as hopefully we ease out of the pandemic?
I don't know. It certainly is a much better shelter solution when you think about a congregate shelter. And again, thinking about the pandemic, the situation we found ourselves in, congregate shelters were not a safe place for folks to be. So hotels enable folks to have the individual privacy. But the real solution is housing, and we have to invest in more affordable housing, particularly housing across all levels of income, as I'm sure David's going to talk about. But for this, people experiencing homelessness, it's housing at extremely low income levels, and there's ways to do that. And right now we have the resources.
And I'm going to bring David in a second. I just want to, for people who maybe don't know as much about the homelessness problem, maybe haven't thought a lot about it, how many of the people you see are basically there because housing is expensive and they just don't have the resources to afford a place that's available, or they don't find any places available, versus folks who we know wind up being without a home because perhaps they have a substance abuse problem or just life circumstances has left them in a place where that's part of a broader suite of issues they're going through? When you look at the population you help, how does that break down?
Yeah, thank you, Ted. That's a great question. In general, there's the 80-20 rule of people experiencing homelessness. About 80% of people experiencing homelessness, it's episodic. It's going to happen once. It's hopefully brief, and once we help them resolve their homelessness, they'll never be homeless again. That 20% of folks are chronically homeless, and those are the folks that have multiple challenges. So they may be experiencing substance abuse, physical illnesses, chronic, illnesses and things like that. And they really experience homelessness much more long term. So for the 80%, we know what the solution is very simple, but it's a lack of available housing. And for many of those folks in that 80% category, they need a little bit of assistance. On average, prior to the pandemic, we saw folks in that category having somewhere between 3 and 9 months of support once we placed them in housing. It's a little bit longer now, but in general, we're still talking about less than a year.
So, David, let me bring you in there. As you hear in that answer, the housing crunch problem seems to go almost across the income scale. Maybe there are some people at the high end where money is no object, but everywhere else you hear, whether it's a middle-class family that can't find that bigger house, a young professional with an apartment search in Providence, folks who are currently homeless because at the lowest end there's not much available. The Realtors track all this closely month to month. Can you just sort of summarize across Rhode Island, all income groups, what the state of the market is right now?
Yeah, so thank you, Ted, for that question. And Michelle is absolutely right. We need housing on all levels. And in terms of the market now, we have seen the median price dip slightly since January to $368,000 for a single-family home in Rhode Island. That has an impact on one's ability to afford, an affordable place to call home, the American dream in owning a home, but it also puts pressure on Michelle and her team and what they're trying to do in the homelessness space. You have folks who want to buy a home, 2 years ago could afford to buy a home, but they can't find that place to call home today, and they're being forced into the rental market, which puts pressure on what Michelle and her team are doing around addressing homelessness.
A domino effect, sounds like.
It's a domino effect, and that ripple effect is impacting the number of listings that we're seeing on the statewide MLS. And we have a breakdown by county. As of yesterday, by county, there were 3 single-family home listings in Bristol County. Kent County 79, Newport County 14, Providence County 176, and Washington County 15.
There were 3 in all of Bristol County?
3 in all of Bristol County for a total of 287 listings at the median price at $370,000.
Okay, well, that was my next question. I mean, and I don't know that you have it, but I mean, how many of those listings fall under $300,000 when you think about middle and low income earners, which are maybe they can afford in the mid-2s or something like that. I don't have it right in front of me, but how many of those listings would they be able to reach?
At $300,000, I believe the number of listings is around 70.
That's crazy. That's a low number. So what is the biggest hurdle in your view to for this market to generate more homes that would people of that income bracket would be able to afford? Are we just running out of space? Is it zoning issues? What's the number one thing?
Yeah, and I think when we look at our municipalities and the way we plan and zone, we have to make it easier for developers to build in many of our municipalities. And it can't be the same municipalities all of the time building the same construction buildings, if you will. Providence, there's a lot of construction happening on the higher end, but we're not seeing the middle class and some of the low and moderate income residents being housed in a Providence, for instance. We've looked at out-of-state buyers and institutional investors, and the share of institutional investors compared to the single-family homes that were bought in 2021, Rhode Island ranks 4th in the nation.
So that's people who come in, buy it, and want to rent it out, where otherwise that might have been one that a family bought.
Correct. And an institutional investor is not just only buying one home or one dwelling in Rhode Island. They're buying hundreds of homes, and that's putting pressure again on a family's ability to buy a single-family home in Rhode Island. So again, we're excited about what's happening with the 2 commissions that I serve on, that Speaker Shikarchi commenced, the Land Use Commission and the Low and Moderate Income Housing Act Commission, but time is of the essence. And I think what Michelle and her team are doing it's just fantastic. However, it's unacceptable to all of us that there are more than 600 Rhode Islanders living on the streets in Rhode Island.
Yeah, is that the current number, Michelle? Is there an estimate across state how many people are without permanent homes?
Yes, as of earlier this week, the number I had was over 1,000 individuals in 600 households who were on the statewide housing prioritization list. So these are folks that are waiting for a housing placement. So over 600 households.
And I can imagine there are some viewers listening who say, I voted for bonds over and over for affordable housing. Maybe they've supported them or not, but they've seen them on the ballot. They'll see groundbreakings by some of the community developers who try to build those affordable housings. Maybe they see discussions in their own community about that. So it seems like there's a lot of activity around this, and yet it doesn't sound like, Michelle, at your end, you're seeing anywhere near the amount of kind of units you need to arrive to meet the needs of this population, which again, who have very little income they can put toward rent.
Right. I think that's true, Ted. You know, the fact is there is some happening, but it's a drop in the bucket. When you think about the fact that we have 600 households right now today who are on the state's coordinated entry list. It's jargony, but it's people who are experiencing homelessness who have been prioritized for housing. You know, the Homes RI Coalition submitted to the General Assembly and the Governor's Office a $500 million investment in housing using the ARPA funds. Rhode Island Foundation suggested $400 million. You know, we think $500 million is a good start, and we have this sort of once-in-a-generation opportunity right now to really invest in housing. Rhode Island has...
We should say it's only $250 in the plan the governor put forward.
That's correct, and while we're delighted that there was, you know, the $250, I think it's a good start. It's not enough, because the fact is we have underinvested for years and years and years, and so we have a lot of catching up to do as a state and a community. And you know, the fact is, you think about these numbers of available, you know, that David spoke about, of available units at a certain price point. Last year, the 2020 average rents, there was one community in Rhode Island that a person of low income could afford a 2-bedroom rent. One out
Which
of
Burrville.
Okay. You know, so the fact is we have underinvested for so many years that we have a lot of catching up to do.
David, you sort of touched on this because you said that the median that dropped just slightly, but the conventional wisdom is that the Fed's raising the interest rates, you know, the cost of borrowing will go up, and that might relieve some pressure in the housing market, you know, cooling it off a little bit. Do you subscribe to that?
I would have to look at some data. I guess the question is, can that household afford that extra $200 or $300 tab per month as a result of rising interest rates? So I'd have to take a look at some data. I think there's some in the economics world who would suggest that some households can, but if you don't have supply, folks aren't going to be housed, and they won't be able to find that single-family home that they're looking for.
Sticking with you, David, you know, I almost want you to put on also your municipal political leader hat, because you know what happens so frequently when new housing is proposed. You know, neighbors, maybe they don't like the design, or they think the density is going to be there, or others in the community think it's going to raise taxes because of the costs that come along with it. You see these endless fights. Developers, builders always complain about that. You know, knowing kind of where the rubber meets the road in municipal government, as you do from your other job, but then being here with the Realtors, what would a solution look like that's actually imaginable? You know, I can't imagine the General Assembly ever taking zoning away from municipalities. Right. And I can't imagine that the types of concerns we see bubbling up are ever going to just disappear one day, because people say, oh, okay, houses are too expensive, build whatever you want, wherever you want. So what would an actual solution look like from all the testimony you've been listening to in your own experience?
No, I think we need to incentivize municipalities. We continue to see the same municipalities every year meeting that 10% benchmark, right? So deeming 10% of your housing stock in every city and town as affordable under the state's definition. And it's the same 5 or 6 municipalities meeting that number every year. I think we need to incentivize municipalities to build more housing, because the argument has always been, this is going to be burdensome to my local budget. I can't afford to educate more children in my district. I think we do have an opportunity with the ARPA dollars to incentivize those municipalities who continue to struggle and tell them, look, if that's your argument, that you cannot afford to build more housing because of pressures on your local budget, we can help you.
But that money will run out.
It will run out, but property taxes also pay, the majority of property taxes pay for education.
Sure. Yes.
So I'm happy to see that the Speaker has made that cabinet level position reporting to the governor.
The new housing czar.
The new housing czar.
Department.
We heard testimony last night. We actually heard it in the Low and Moderate Housing Commission, why that should be a cabinet level position, reporting to the governor and the governor only, because there are so many agencies, regulatory agencies, that touch housing in our state. But this person needs to have a team around him or her. We're confident that at some point you're going to see a housing department within state government. That's how it will work. The first step was getting someone in place, a cabinet level member, Now what we would like to see is a department that addresses housing on a consistent basis.
All right, David Salvatore from the Rhode Island Association of Realtors and Michelle Wilcox from Crossroads, Rhode Island. Thank you very much for joining us on the program.
Thank you both.
Thank you.
When we come back, a reporter's roundtable. Eli Sherman, Steph Machado join Ted and I. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White. That's Ted Nesi joining us for a reporter's roundtable. Our Target 12 investigative colleagues, Steph Machado, Eli Sherman. Good to have you back on the program. Steph, we're going to start with you and the development on the police use of force case from last July, just to get people up to speed. 2 officers were under investigation for punching a juvenile after a car full of teenagers led police on a chase. They were pointing BB guns, as we all remember, at people. Police, of course, weren't sure if they were real guns or BB guns. After they stopped the car, one juvenile, as they said, was punched, and then a police officer also spit at one of the juveniles there, and you can see Officer Domingo Diaz there was being pulled away from that scuffle. So the development this week, Steph, was the Attorney General announced that neither of the officers under investigation would be charged. He made the decision on one of the officers, Mitchell Voyer. For the other, Domingo Diaz, prosecutors brought it to a grand jury, same result. So I'm wondering, I guess the question to you is, what makes this different in your view from other police use of force cases where the officer was charged, and I think Joseph Hanley?
Right. So if you look at the Hanley case, where he was accused of beating up a suspect who was on the ground in handcuffs, the Attorney General decided to charge him without going to a grand jury.
Right.
That was, when I spoke to Attorney General Peter Nerona earlier this week, he said that was really just more of an open and shut case. It was more clear what had happened, and he cited the fact that the victim, Rashad Gore, was just sort of sitting in his car before this incident had happened, whereas with this case that we're talking about now, these juveniles are accused of having just led police on an all-night chase throughout the city. They were armed with BB guns, which they looked like real rifles. Police were treating them like real rifles. And so he did take that into account when he looked at the force that was used. Plus, he says this teen was resisting arrest, for example. But yes, he chose to bring this case of Domingo Diaz to the grand jury because he said it was too close to call, unlike the Hanley case.
Well, and the biggest, I think, one of the bigger driving factors that I saw in all the 1,000 plus pages that we read through that day, they had 2 experts, use of force experts. One of the experts said, that the use of force was excessive. The other one said, no, that was, within the confines of their police training, and it was justified. And I have to think that if I'm a defense attorney for those police officers, I am leaning very heavily into the findings of the expert that said, this was okay.
Right. So you have to think about what a jury would think if they're presented
beyond
with
a reasonable doubt being the
experts
standard.
in this field giving opposite opinions. And that was part of his decision, too. I'm just going to let the grand jury decide whether or not this constitutes assault.
I also think it's interesting, and I'm curious what you think, Tim, having covered these sorts of incidents for a number of years, how body cameras and body cam footage have changed both the actual adjudication of these incidents, but then also, I'm sure, public perception, because we just showed what happened that night, or at least we showed one view from one camera, multiple cameras, and I just think that's just had a huge effect on how these
not just
play
body
out.
cams, Ted. I mean, think of the George Floyd case where cell phones are ubiquitous, and that was a cell phone video of that incident. But certainly, body cams in Providence, the first department in the state to go to body cams, has really changed the landscape on these investigations, where the Attorney General has told us on this program that that video has become valuable evidence in not only determining whether or not to move forward with charges or go to a grand jury, but also in prosecuting the case. So it is a big deal. Shifting gears. Eli, we're going to go to you. We learned this week, and I want to bring up a chart and have you walk us through it, more about the COVID-associated hospitalizations. And these are the people who go into the hospital because they have COVID, or they go to the hospital for an appendectomy or something, and they are tested positive. So the chart is on the screen. Walk us through it.
Yeah, that's obviously a big talker for a long time during this pandemic. I want to draw people's eyes to the thin red line that goes across several months. That is showing what percentage of the hospitalizations, the patients in the hospital, are there because of COVID. So you can see back in August, it was as much as 81% of the people who were there because of COVID. The remaining 19% were those, like you mentioned, Tim, who might have broken their leg, but also tested positive. Now that rate has held pretty steady all the way up until about the new year, where you can see there all of a sudden it starts coming down very sharply. At that same time, Tim, the Omicron variant, the one that was so infectious and really contagious, was rising very quickly, but it was having a less severe effect on people. So many more people were getting the virus, but fewer were ending up in the hospital. So you see that percentage starting to fall at that point. So very interesting new set of data that the Department of Health has started to provide to the public.
And with this chart on the screen, and keep it up, Jen, if you could, the light blue in the bar, that's the share of people who tested positive went in the hospital. They didn't go to the hospital with it. Is that right? Am I reading that right?
No, so those are the people who went to the hospital. Everyone in the red and the blue went to the hospital, but the blue is the section of people who are there, but were not there.
That's what
because
I mean.
of COVID.
That's right. They went in there with a broken leg,
or
but they did test positive.
But they
did test positive.
And you know, we should point out that whether you go to the hospital because you have COVID and tested positive for it and you're really sick, or you go for the appendectomy and you test positive, the hospital's response is really the same. Like the drain on resources is still the same, right?
Absolutely, and this distinction really is not that important to the hospitals because, like you say, if someone comes in with a broken leg and they test positive for COVID, it still requires the same protective gear for the nurses and doctors that are treating them. They cannot keep them with non-COVID positive patients. So there's still a lot of resources and drain that affects the hospitals regardless. But we do know, and for a long time, this has been a bit of a flashpoint in arguments between people who like to debate the severity of the pandemic. And to the state's credit, you know, they've been trying to show more and more data, and this data has been shown in Massachusetts now, I think, since January, and in several other states. So we're seeing a development here of a clearer picture of what we're seeing in terms of the pandemic.
Do we know why it took so long for them to split the data up this way? Because
Ask
people
like a
have
true reporter.
people have been talking about this, I think, basically since the pandemic began.
Yeah, so interestingly, they started asking the hospitals to show the distinction between these populations beginning in January. And then they used an algorithm to look back at discharges all the way back to June. We're getting really in the weeds here.
That's what this show's about.
And they were able to analyze those discharges and get the ratios of the amount of people who were there because of COVID versus those who were there with COVID, and get the look back. And I just think that from the time they made the decision in January that they were going to start showing this data, here we are a few months later where they're actually at a place where they're ready to present it on a regular basis.
All right, we got 2 minutes left, and we can't have Steph Machado on the program and not talk about the Providence mayoral race. And why don't we take a minute to bring up the candidates running for mayor of Providence, and these only Democrats have announced so far in this race. On the left-hand side, you can see Gonzalo Cuervo. We also have Nirva LaFortune, then Brett Smiley, and Michael Solomon. Where do all these candidates start off right now, Steph?
Well, some of them, particularly Smiley and Cuervo, have been running for mayor for a year and a half, since 2020. So they have been spending a lot of time
this is Smiley's second run.
Yes, exactly.
Yeah, I'd argue Brett's been running for a decade.
You could say he's been running, exactly. He dropped out in 2014 to endorse Alorza, but has pretty much been running ever since. And so they've been raising money, they've been getting staff. Nirva LaFortune got into the race in the fall, so she's also been working on getting her fundraising numbers up. She's a little bit behind the other two in terms of fundraising dollars. Michael Solomon has really been, he's the former council president. He has had a much quieter run so far. He does tell me he's planning a formal kickoff this month, but he told me he didn't do any fundraising in the first quarter that ended this week. He does have enough money to self-fund, so he'll be an interesting one to watch to see what his place in the race will be. But we're really getting into that spring and summer campaigning season where regular people who aren't so politically inclined are going to start paying attention more.
Well, I got to tell you, it feels like kind of sleepy campaign-wise, and I don't mean just Providence mayoral, but certainly weigh in on that if you want, Ted. Maybe it's a calm before the storm.
Yeah, Nancy Lavin had a good piece in Providence Business News this morning about kind of how virtual campaigning has been. There's a lot of that because of COVID, right? I can't have an event, so I'll do a video. But I think it's also led campaigns. You know, I've been surprised. There have been times a campaign has announced something that I feel like historically might have come out with a event. You know, Helena Folks this week called for a $500 one-time tax cut to everyone, just in a statement.
Right.
You know, and things like that, where it used to be they'd do a lot more hullabaloo to try to get cameras there and get more attention. And so some of me thinks it's a hangover from the pandemic. People have to get back into the habit of like going to things and calling events and everything. But I do think it's also the inevitable, as Steph said, we're hitting springtime. The campaigns had a very busy week finishing their fundraising, because don't forget the first quarter ended on Thursday. So they were busy, but that was all behind the scenes. Now I think you're going to start to see more of it in public.
All right. Well, we have to wrap up the program. If you missed any of it, we did a segment on the first half on housing and homelessness. You can catch it on WPRI.com. For Eli Sherman, Steph Machado, and Ted Nesi, I'm Tim White. We'll see you next week on Newsmakers.